Hello friends, welcome to the fourth week of this 12-week certificate course on palliative care with integrative approach. In this fourth week, we are going to talk fundamentals of complementary medicine and integrative approach in palliative care. In this week, we will talk about Ayurvedic contribution in palliative care and holistic management of pain and suffering. Pain and other symptoms is the main issue which has to be taken care by a palliative caregiver. In Ayurveda, there are different approaches. In naturopathy, there are different approaches. They can be complementary to the modern medicine approach of management of pain and discomfort. So you should know, in this fourth week, we are going to talk what are the unique USPs of Ayurveda for the pain management that can be applied. Key ethical principles: autonomy, respecting patient's choice, beneficence and non-maleficence, maximizing benefits, minimum harm. That you have to decide. How you will decide, what tool you will apply, that will be discussed in this class. And justice, fair access to palliative services. There will be 5 lectures in the fourth week focused on yoga and exercise and comparative approach in palliative care, naturopathy, and music therapy and coloring therapy in palliative care. We will also discuss symptom management through kitchen spices, part 1. Second is part 2, the same thing. Lastly, we will discuss integrating system for better care. How to integrate Ayurveda and allopathy. You are being a palliative caregiver, you are not a doctor, but you are a bridge between patient and the doctor. You are patient and the Vaidya. The team work, organization will be done by you. But what are the qualities you should have to make the better bridge, better communication in a team member? That will be taught in this week. With this, and the last question, what you will experience, real life case studies and ethical dilemma, that will be discussed here. Collaboration between the practitioners, method and object of the collaboration, and compensate lawful end of the life care. These aspects will be discussed here. Let us begin with patient listening to all the lectures. My team members will deliver their talk, and you have to understand. And as a reflection, you have to answer some questions which will be framed in each lecture. And in the end, we have put a Google Class note. You can put your views on that. Thank you very much.